Healthcare, obviously. No sooner had the president made it official than 13 states foiled a joint lawsuit to block the legislation, citing the unconstitutionality, in their view, of the mandate. Add in a separate lawsuit just filed by Virginia, you get a total of 14 states now claiming the unconstitutionality, specifically taking issue with that mandate. Joining us to discuss that mandate, Attorney General of Michigan, Mike Cox, who is part of the lawsuit. Where specifically in the Constitution do you believe it has been violated by this mandate?
Well, Dylan, the real question is, where does the president and Congress have the authorization to do what they did, which is to say that you sitting at home as a price of citizenship must buy health insurance or we will fine you. We say that nowhere in the Interstate Commerce Clause, nowhere is that allowed, nowhere in Article 1 is that allowed, and certainly this also does impair people's rights under the 10th Amendment. So we say the reverse of what you asked me. Where do you get the authorization to do this?
Understood. The lawsuit is a great opportunity to have this conversation. Right. So I want to just talk to you about this philosophically. You and I both know that young people don't require a lot of health care, generally speaking, unless they wreck their motorcycle or whatever it may be, generally speaking. And as you get older, your health care bills go up because as you age, unfortunately, you're required to have more medical attention. It's a human condition. We can't do anything about it. You and I also both know that an insurance pool fundamentally works by pooling risk, whether it's car insurance, home insurance, hurricanes, whatever it is, and that we need that pooling in order for it to work. That if only the sick buy health insurance, it's too expensive, and then the young will never buy it, and if only the sick have to buy it, it's too expensive. The only resolution to that is some form of a mandate, which is the sort of thing they came up with car insurance for this exact reason. My issue with this tends more towards a mandate without reforming and giving people choice is utterly insane. It's why the stocks are up so much. Your issue is the mandate in and of itself is not even constitutional. How do you look at the need for basically risk pooling in healthcare in the context of the mandate?
Well, Dylan, here's a stumbling block. As you pointed out, there isn't constitutional authorization for that. That being said, there are other ways to address pooling. That being said, as I just heard former Governor Dean talk about, there are other ways of reforming the system to increase accessibility and quality at the same time. Getting rid of fee-for-service is one of those things. Increasing the use of health savings accounts is another way to give both patient and doctor control over what drives the system instead of an insurance company. You know, what is interesting, and I'm moving away from the law right now, this is called reform, but we see that the drug companies and the insurance companies and the hospitals have greater control and have more customers than they ever could have dreamed of before this came along. So they're telling us, trust us, it's good for you. We're violating the Constitution, but trust us. Trust us, it'll be cheaper for you, but we're back-ending all the costs.
Yeah, no, and I think that's where we end up, again, whether it's a conversation I would just have with, again, a conservative physician, U.S. Senator Tom Coburn. I just talked to Howard Dean, also a very obviously informed and capable, not only politician, but physician. I talked to you. We're all having the same conversation, but there's a new mark which is cover everybody, and now it's going to really bring the skeletons out of the closet as to who's rigging the game and who's picking people off, wouldn't you say?
I would say that, but again, I'm here simply because the Congress and the President have run over the Constitution, run over the Article 1 of our Constitution, the 10th Amendment. But clearly, there's a whole lot of other policy questions that ought to be asked.
Yep, and it's going to be a fun couple of years for it. It'll be good for me being in the cable TV business and all. Attorney General Cox, thank you so much for the time today. I appreciate it.
Thank you, Dylan.
Thank you.